So this is an easy one. So you have a 14-year-old girl. She's coming to you with primary amenorrhea with well-developed breasts. Yes, so please remember, for the definition of primary amenorrhea, there is absence of menses or no menses by 13 years of age in the presence of secondary sexual characters. So because in this girl the secondary sexual characters are present, that is why the diagnosis is made at 13 itself, and we will definitely evaluate her. Can you tell me what is the cutoff when the secondary sexual characters are absent? Then the cutoff becomes 15 years. So no menses by 15 years of age in the absence of, okay, I did a mistake there, sorry, just reverse it. So 13 years, no, I didn't do the mistake, I was right. So 13 years, did I write absence in the first go? Yes, so 13 years in the absence of secondary sexual characters and 15 years in the presence. So please correct it in case I wrote it the other way around, right? So 15 years is the cutoff in the presence of secondary sexual characters, and 13 years is the cutoff in the absence of secondary sexual characters. I think I wrote it other way around, so please correct it. Okay. So if secondary sexual characters are present, you should wait for 15 years of age. If they are absent, you should wait, or you should start evaluating at 13 years of age itself. Is that clear to everyone? Yes? Okay. Now, if you look at her local examination, what do you see here? You see a bulging membrane. Yes? So, you see a bulging membrane. So, you know, whenever we see a bulging membrane, we know we are dealing with imperforate hymen. So, now you're going to tell me a few things that point or that you should know about imperforate hymen. So, my first question to you is, can you tell me what keyword would you look for in the history when we talk about imperforate hymen? What should be the keyword in the history? Anybody? So, the keyword in the history would be cyclical pain. Yes? So, the keyword in the history is cyclical pain. What else? Second important things. The patient will have normal secondary sexual characters, which means the breast development is normal, pubic and axillary hair are normal, right? So, secondary sexual characters are absent, okay, are normally present, not absent, they are normally present. If they are absent, then it cannot be imperforate hymen. So, cyclical pain, normal secondary sexual characters. What else? What about hormonal levels? So, very, very important. She will have normal FSH and LH levels, right? So, the FSH and LH levels are also going to be normal, okay? Then, can you tell me, can this girl who has imperforate hymen, what can be an important per abdomen finding? Anybody? What can be an important per abdominal finding? So, can she have a suprapubic bulge? Yes or no? Yes, Hannah, she can have a suprapubic bulge. So, this suprapubic bulge can be a uterus. This suprapubic bulge can also be a full bladder. Yes, so she can have a enlarged uterus and she can have a full bladder. Now, you're going to tell me first, okay, why would her uterus be enlarged? So, this is because of a possibility of hematometra. Yes, collection of blood in the uterus and the uterus gets enlarged. What is the cause of full bladder? Very good. Yes, the cause of full bladder can be hematocolpos. What happens when the hematocolpos, which is collection of blood in the vagina, becomes too big? It is going to cause, yes, you are right, acute urinary retention. Yes, So the cause of acute urinary retention is the collection of blood in the vagina. Now, so since this suprapubic bulge can be an enlarged uterus, it can be a full bladder. How do we get to know whether it is uterus or whether it is full bladder? So one of the simplest ways is ultrasound. Yes, you can always do an ultrasound and see whether the uterus is enlarged or not. What is the other way? Foley's catheter in the bladder. So when you catheterize the bladder and the bulge disappears, then you know that it is a full bladder. Yes, so when you catheterize and the bulge disappears, it tells you that it is a full bladder. Yes, is that clear to everyone? Okay, wonderful. And yes, very, very importantly, majority of times, you know, these days we have access to ultrasound, so we preferably do an ultrasound. But yes, if you don't have an ultrasound and on local examination, you want to find out whether the uterus is present or not, yes, whether there is a collection or not, then definitely yes, we can always do a PR examination as well. Okay, so in the PR examination, you will be able to feel the hematocolpos. And on the PR exam, you can also look for the uterus. So you will know whether the uterus is present or not. You may not be able to know whether it is enlarged or not, but the presence of the uterus can be seen through the rectal examination as well. But clinically, these days, we don't do PR examinations. We would obviously prefer to do an ultrasound for the patient. Is that clear to everybody? Yes? All right. So those were the key things that you should know about imperforate hymen. We have another question where we talk about the treatment. So I'll talk about it there itself. But yes, imperforate hymen is a very basic question. You know, it's easy to pick up. But yes, if they go in depth, you should know these tiny details. All right. Is that clear to everyone? Okay. I want to ask you something. Let's see who is going to answer from the chat box. Why is this not testicular feminization syndrome? Anybody? Why is this not testicular feminization syndrome? Any keyword? The keyword is normal pubic hair. So in testicular feminization syndrome, pubic hair are actually absent. They can never be normal. So this is what actually rules out testicular feminization syndrome. Although they can have a blind ending vagina, but they cannot have normal pubic hair. Is that clear to everyone? Yes? Okay. And how will we see whether it is MRKH or not? Anybody? So in MRKH, usually it is a absent vagina, which means you don't see the vaginal opening. There is a vaginal agenesis. So here you're not seeing an absent vagina. You can very well see an opening of the vagina and you see that there is a bulging membrane, right? So most of the times in MRKH syndrome, there is a vaginal agenesis, right? And if there is doubt, again ultrasound is the key. In MRKH, uterus will be absent, whereas in imperforate hymen, uterus will be present. Is that clear to everybody?